Hello, I'm Professor Bill Kling from UIC School of Public Health, and I'm in the Health Policy and Administration Division, and I'm very pleased that you took the time to check out our website. In addition to serving on the HPA, or Health Policy and Administration faculty, I'm also on the faculty of the DrPH program, and very pleased to work with the high level of students that attend the DrPH program. My focus in health policy and administration is on the policy side. I am an attorney by vocation. I spent over 20 years practicing law, particularly in the public sector, representing school districts, municipalities, and colleges and universities. And in that realm, I was able to work extensively on action-oriented policy development, working with policymakers to help them understand and be aware of those issues impacting the public sector. Through that work, I got very interested and passionate about public health. My entry point was really through work on obesity prevention. I worked for many years as the policy consultant for an organization here in Chicago called the Consortium to Lower Obesity in Chicago Children. In that position, I was a contract consultant with CLOC and worked on legislation at the state, federal, and local level with CLOC to engage the community partners on obesity prevention for children in the Chicago area as well as the state. That was my entry point into public health work. Since then, I've done a myriad of projects and worked with a myriad of community-based partners and non-governmental organizations on really serving as a policy coach to these organizations, helping them develop policy action plans, which really define in an action-oriented manner how we work with policymakers around a particular public health, public policy issue. This is also what I teach, and I'm very passionate about teaching. I enjoy working with students immensely. It was a very easy transition from the practice of law into the classroom. I've taught adjunct at a law school here in Chicago for many years, and I've been here on faculty at UIC for 5 years, so I'm very pleased to be a faculty member here. My coursework is in two areas. One is policy development, and the other is organizational leadership. So as you can tell, melding those two together is a perfect opportunity for DrPH students. For the master's level students, I teach an intro to public health policy course in which students develop their own policy action plan on a topic of their choice, a public health topic of their choice. And it's very exciting to work with the students on a myriad of issues and really a broad base of very interesting topics that students choose. The end product for the students in the master's course on policy is the development of a website in which they translate the research and the policy documents into an action-oriented website. And it's a great tool for the students and a great learning opportunity for them. I also teach at the master's level a course entitled Introduction to Organizational Leadership. This is a higher level thinking course. The concept of this course is really to make students think about themselves as leaders, as organizational leaders. How can you impact and effectuate change in an organization, both internally and external to that organization? It's a very exciting class in that students really delve into their own leadership attributes, their own leadership styles, and then translate those into the real world. So it is really an exciting course, and I enjoy teaching that. Through the work on those two courses, I have developed with my team member, Professor Karen Peters, a course that we teach in the DrPH program, which is the 510 course. And the 510 course is really a melding of the policy and the leadership components. And I teach the kind of practical application-based policy development. And again, the DrPH students do a similar exercise, just at a higher level, similar to the master's students, in developing a policy action plan, selecting a topic, looking at how it's impacted by larger policies globally, like the Millennium Development Goals, and nationally like Healthy People 2020, and locally even here in the Chicagoland area, like Building a Healthier Chicago. So we look at these kind of larger policy templates, and we look at how our individual policy action plans relate to those, are relevant to those, work within those rubrics. So it's a really interesting and very practical course. Professor Peters really takes an analysis, more theoretical take on policy development. And so it's a really nice course for students, and we've had some very good results. So the bottom line is then that we really try and mesh the leadership components with the policy components to really promote, engage, and enhance those leadership attributes, so you're able to effectively take them into the policy arena. So again, we look forward to seeing you soon and talking to you in the near future. I'm available, and on the website you will find my email address and telephone number, and please feel free to contact me. Thank you very much.